The next lecture we shall be talking about is Kawasaki's disease. Now, we're going to always start with a case in this lecture because I think cases put all this disease pathology into one picture. Now, this is under medium vessel vasculitis. Okay? This is a medium vessel vasculitis. Okay? Vasculitis, inflammation of a smaller blood vessel. Got aorta, the big, thick muscular arteries, and we got the smaller, medium size, and then we got the tiny little small vessels. Now, so let's talk about a case. A 2-year-old Asian male was brought in. 2-year-old Asian male presented to ED with 6 days of fever, temperature of 102.5 degrees Fahrenheit. You notice on physical exam, the child has bilateral conjunctivitis. You also noted that he has a rash and his tongue is red. Also, the patient has lymphadenopathy, cervical lymphadenopathy. And his hands are swollen. Swollen hands. What is the drug of choice to treat this condition? Well, since you already know the title of the lecture, you can bet you guessed the answer right. The answer is the diagnosis is Kawasaki's disease. Kawasaki's disease. Now, Kawasaki's disease is a very, very interesting disease. They love to test Kawasaki's because they can either test you on how to diagnose the condition or what medications you need to treat the disease. So in this case, this patient has Kawasaki's disease, and the modality of treatment is IV immunoglobulins. So if you see IVIG, intravenous immunoglobulins plus aspirin. Now, how are you going to be able to remember Kawasaki on the boards? Now, that's what the bread and butter of this lecture is all about. We're going to use a mnemonic known as crash burn. Crash burn. You must remember this mnemonic. Now, the first word says the kid had conjunctivitis. The eyes is very, very inflamed. So if you take a look at the eye, right, you see it's very, very red. That is conjunctivitis. Okay? And then they have a rash. They have a rash all over their body. That's why I told you the patient had a rash. And they have adenopathy. And what kind of adenopathy? It's cervical adenopathy. That's why I told you the patient had cervical adenopathy. So when you palpate, you feel like, oh, wow, oh, that hurts. Yeah, that's cervical lymphadenopathy. The S stands for strawberry tongue. Strawberry tongue. So if you look at the kid and you look at their tongue, it looks like a strawberry. Okay? So they have a strawberry tongue, and the age is hands swelling or peeling from the rash. So they say have swollen hands, that is the age. And the last but not the least is burn. These patients have uncontrolled fever for greater than 5 days. Now that is very important. That is how you make the diagnosis of Kawasaki's disease. They have to have fever for more than 5 days, okay? That is very, very, very important, okay? So they've got crash, burn, and you see they have all those symptoms. The patient has Kawasaki's disease. Now this is their favorite on the boards. They ask you, what is this patient's most likely can develop? Like, what is the most likely complication of this disease? And you can guarantee you, if you ever get this question, you are gonna get it. And the answer is they are predisposed to coronary artery aneurysms. Coronary artery aneurysms. You must remember this. Coronary artery aneurysms. The problem with coronary artery aneurysms is because they can rupture and these patients can develop a myocardial infarction. So if this is the heart and that's the coronary artery and they develop an aneurysm on their LAD, right? So this is the heart. If you rupture this, what happens? There's decreased perfusion to the rest of the heart, which is the same thing as myocardial infarction. And then they develop an area of necrosis, which is bad for the kid because this kid is very young. So you want to treat them immediately with IVIG and aspirin. And aspirin is an antithrombotic agent. It prevents them getting coronary artery thrombosis, right, by inhibiting platelets from adhering to each other, right? So that's very important. That's why we give them aspirin and give them intravenous immune globulins. So remember, conjunctivitis, rash, adenopathy, strawberry tongue, hands. They usually have a red like erythema in their hands, and that's very important that you know that. Hands and feet, okay? Hands and foot. So we don't forget that. Hands and foot erythema with peeling from the rash. It's called a desquamating rash. Desquamating rash. Desquamating is just a fancy word for a rash that's peeling off the skin. And that's basically what Kawasaki's disease is. That brings us to the end of our lecture. Hey, thank you so much for watching the video. I hope you learned a lot. Are you studying for the USMLE Step 1 or Step 2? Are you studying for the NCLEX or you're currently in nursing school as a nursing student? Are you a PA student currently in school or studying for your PANCE exam? Or are you a nurse practitioner student or trying to take your NP board exam? Listen, I've got super awesome content for you. If you truly love this video and it simplified your learning process, I want you to check out my website below. I've listed all the list of exams, whether you're studying for any of this board exam, and all I want you to do is click on the link right now below so that you can take you directly to my website. For USMLE, just go to smashusmle.com. For NCLEX, go to crushnclex.com. And if you're studying for the PANCE exam, the nurse practitioner exam, or you're studying for your internal medicine board exam, just click below and it'll take you directly to ftplectures.com. Listen, I can't wait to help you. If you need to get in touch with me, just get to my website, you're able to reach me directly, and we can work together one-on-one. Listen, you're super awesome, and my goal here is to help your dream come true. If you want to be a doctor, want to be a nurse practitioner, a registered nurse, or physician assistant, I'm here to help you get to that next level. With your medical knowledge, let's save the world together. I love you guys. You guys are super awesome, and do not forget to click on the link below to be able to get to my website. Also, don't forget to subscribe to my channel. You guys have a great day. Let's go.